These are the tools used to administer the Queen's College Step Test. We have a metronome, a timer, and a step that's 16.25 inches, which is the standard height. Cadence should be set at 88 beats per minute for women, which is 22 steps per minute, and 96 beats per minute for men, which is 24 steps per minute. Since we have a female subject, we'll be using 88 beats per minute for the cadence. I'm now going to administer the Queen's College Step Test, and I'm going to demonstrate for my subject first. In order to make this test the most efficient, the subject should move their legs up and down in an alternating pattern. The test lasts for 3 minutes. Make sure your subject is placing their feet firmly on the step in order to reduce the risk of injury. Five seconds after the test is complete, take the subject's radial pulse. The client's VO2 max is determined from the recovery heart rate using the sex-specific formula given on the slide. The lower the recovery heart rate, the more fit the individual. The purpose of this test is for the prediction of cardiorespiratory fitness. It's important to remember that while for some subjects this may be a submaximal test, for others they may exert more energy.
To administer the 3-site Skinfold test, we'll need a caliper to measure, measuring tape for the tricep measurement, and a marker to mark the site we're taking the measurement at. For this test, it's always important to make sure that the subject is comfortable and to protect their privacy. I'm going to administer the 3-site Skinfold test. For the tricep measurement, have the subject bend the arm at a 90-degree angle in order to get an accurate halfway point. Use the marker to mark the back of the arm where the measurement will be taken. When taking the actual measurement, make sure your subject relaxes their arm. Pinch in a vertical fold for best accuracy and make sure the caliper is placed under the area you're pinching, right on the mark. Hold the caliper measurement for 2 seconds. For this fold, the measurement is taken about 2 centimeters to the right of the belly button. This is also taken as a vertical fold, and repeat the caliper technique used for the first Skinfold measurement. This measurement is taken as a diagonal fold with the natural angle of the iliac crest at the anterior axillary line above the iliac crest. The same caliper technique should be used. Skinfold measurements can be a reliable and accurate determination of body fat percentage if the person administering the test is properly trained. This test is an accurate determinant of body fat over a standard BMI test due to the fact that the latter doesn't take other factors such as muscle into account. Some important things to remember when administering the test are that all measurements should be made on the right side of the body with the subject standing upright. And also, it's a good idea to take duplicate measures at each site and retest if duplicate measurements are not within 1 to 2 millimeters of each other.
In front of you, you will see 3 things to measure blood pressure: a stethoscope and sphygmomanometer, which consists of a pressure dial, blood pressure cuff, and pump.
So the test I'm going to administer is resting blood pressure. And the first thing you're going to want to do is talk to your subject and make sure they're calm and they've been sitting a while.
Your subject should be seated with feet flat legs uncrossed, and the arm free of any clothing and relaxed. The arm you are using for the blood pressure measurement should be well supported by you or a resting piece of furniture. Your client's back should also be well supported. Cuff should be snug but not too uncomfortable. It should be slightly above the bend of the elbow. The palm should also be facing upward. Place stethoscope on the brachial artery, which is on the medial part of the upper arm close to the elbow. Quickly inflate the blood pressure cuff to approximately 140 to 180 millimeters of mercury for a resting blood pressure. Deflate the pressure slowly, 2 to 3 millimeters of mercury per heartbeat, by opening the air exhaust valve on the hand bulb. Rapid deflation leads to underestimation of systolic blood pressure and overestimation of diastolic blood pressure. The measurement of blood pressure is a vital component of a resting health-related physical fitness assessment. Blood pressure measurement is a relatively simple technique and may be used in risk stratification. Systolic blood pressure is the contraction phase and the first noise you hear. Diastolic blood pressure is the relaxation phase and the last sound you hear. The chart shown helps an individual see where they stand when it comes to risk for hypertension. Hypertension cannot be diagnosed from a single measurement. Serial measurements must be obtained on separate days. Hypertension or high blood pressure is a condition in which the resting blood pressure, either systolic blood pressure or diastolic blood pressure, or both, is chronically elevated above the optimal or desired level. The standards for classifying resting hypertension are presented in the table above. So now I'm going to take resting heart rate, and you take that at the radial artery. Lightly palpate the radial artery with your index and middle finger to find radial pulse. Take heart rate for 15 seconds, then multiply by 4 to get the resting heart rate. This is important to know if you wanted to determine exercise heart rate zones.